This is deep transverse friction to the gastrocnemius. So this would be used when somebody had had a previous calf tear and they had scar tissue which had been laid down, and we were wanting to use the deep transverse friction to break down that scar tissue. So we would locate exactly where that scar tissue is within the muscle. Possibly we would do this after completing some effleurage or petrissage techniques. After locating the scar tissue where the previous tear had been within the gastroc muscle, what we would want to do is to sink down onto those fibres, and we could do that either with reinforced thumbs, as so, or with reinforced fingers, like so. Either way, you want to make sure you reinforce your applicator and you maintain the position of your joints in a nice relaxed position, so you don't allow the thumbs, for example, to come back into extension. So sink down onto the tissue where you feel that thickened scar, right onto it with depth, and then you want friction across the fibres in a transverse direction at that depth. You would continue that for 60 seconds or until the patient says that that went numb. Because this is a friction in a muscle belly, you can keep the muscle in a nice relaxed position. So after 60 seconds, we would check that that had numbed off for the patient. And then we would come off and allow that muscle just to rest for about 30 seconds. After which point we would then repeat that by sinking back down onto that scar tissue at depth and completing our transverse movement, frictioning over the scar. We would continue to repeat this for 60-second frictioning, 30-second relaxation for a whole 10 minutes.